Hi.
Do you mind if we ask you some questions?
Not at all. You can come along.
What inspired you to go into medicine?
I really wanted to do something where I could work with my hands and think with my brain, and medicine really, and take care of people, and medicine really does all of those things.
What's your favorite thing about medical school?
My favorite thing about medical school is the community. It's being with people who are also really interested in helping people and people who are really smart and invested in their craft.
And how do you prepare for all these?
I do a lot of flashcards and I do a lot of multiple choice practice questions.
What's your biggest study tip?
Biggest study tip is don't just focus on one topic when you're doing practice questions, but do a mix of all of the different questions because that's how it'll show up on the exam.
And what music do you listen to?
I listen to a lot of different things, a lot of non-English music. I listen to a lot of indie and alt rock. Those are probably my main genres.
What's the hardest part of medical school?
Hardest part of medical school at the beginning is finding your footing and getting used to studying, and then later on during clerkships, it's the fact that you're just constantly being watched and getting used to that. That's really hard.
If you weren't studying medicine, what would you be doing?
No, maybe politics, honestly. Anything where I can help the most number of people as possible.
Coffee or tea?
Oh, coffee for sure. Definitely coffee.
What's your go-to study snack?
Go-to study stack, probably popcorn. I usually make it on the stove myself.
What's one thing you wish people knew about medicine?
That we like to have fun. Like, we don't just work. We also have fun, watch movies, play games, etc.
Exercise, yes or no?
Oh yes, pretty much 5-6 times a week. It really is key to bring down my anxiety.
Sneakers or Crocs?
Sneakers, although a lot of people like Crocs in the hospital, it's not for me.
What's the hardest test you've taken so far?
Step 2, it's 9 hours and it's brutal.
What's your advice for newbies?
Make connections, take it slow, you will get there. It's a journey, but there's a lot of people there to support you.
What's the best thing about being at the Keck School of Medicine?
The patient population between Keck, where you have like the really, really sick patients, to County, where you have the really, honestly, disadvantaged patients that you can really help and build a better life for, help build a better life for.
And what kind of doctor do you want to be?
I want to be, in terms of specialty, a urologist, because as I said, it really melds that working with your brain and diagnoses and then also operating and doing procedures on people. But in terms of being a doctor, I want to be a doctor that takes care of the whole patient and that really is able to make patients' life better, not just in treating their disease, but finding the best course for them.
Thank you.
Yeah, thank you.